Below is a fully detailed, textbook-level monograph for Scopolamine, Transderm Scop. This is educational only and not a substitute for professional medical advice. Scopolamine, complete drug monograph. Generic name, drug class, brand name, drug forms. Generic name, scopolamine hydrobromide, also called hyoscine hydrobromide. Drug class, anticholinergic, antimuscarinic, antiemetic, belladonna alkaloid derivative. Brand names, Transderm Scop, most common U.S. brand. Also available internationally under Scopoderm, scopolamine patch generics. Drug forms, transdermal patch, 1.5 milligrams, releases 1 milligrams over 72 hours. Injection, less commonly used for motion sickness. Oral forms exist in some countries, but patch is standard for nausea, motion sickness. Number 2. Definition: scopolamine is an antimuscarinic medication that prevents nausea and vomiting by blocking acetylcholine in the central nervous system, specifically in the vestibular apparatus and vomiting center. It is most commonly used as a transdermal patch that delivers medication for 3 days, 72 hours. 3. Mechanism of action, MOA. Scopolamine works by A. Blocking muscarinic M1, acetylcholine receptors, acts on the vestibular nuclei, balance center and inner ear, acts on the vomiting center, medulla, reduces cholinergic transmission along neural pathways involved in motion-triggered nausea. B effects: inhibits vestibular stimulation, decreases secretion, salivary gastric, mild sedation, central anticholinergic effects, crosses blood-brain barrier. This makes it particularly effective for motion sickness and post-operative nausea, vomiting, PONV. Number 4. Pharmacokinetics, ADI. Absorption, absorbed through the skin via transdermal patch. Onset, 4 to 6 hours. Peak concentration, 6 to 24 hours. Distribution, highly lipophilic, crosses blood-brain barrier, placenta, distributes widely in smooth muscle and secretory glands. Metabolism, primarily hepatic metabolism. Elimination, half-life after patch removal, 9 to 12 hours. Excretion via kidneys. Duration of action, each patch lasts 72 hours. Number 5. Uses, therapeutic uses. Prevention of motion sickness, most common. Prevention of postoperative nausea and vomiting, PONV. Adjunct for gastrointestinal spasms, less common. Adjunctive therapy for Parkinsonism, tremor, historical, rare. Sedation and drying of secretions in palliative care, off-label. Number 6. Indications. FDA approved for 1. Prevention of nausea and vomiting associated with motion sickness. 2. Prevention of postoperative nausea and vomiting associated with anesthesia analgesics. 7. Contraindications. Do not use scopolamine if the patient has absolute contraindications: hypersensitivity to scopolamine or belladonna alkaloids. Narrow-angle glaucoma can precipitate acute angle closure glaucoma. Obstructive uropathy, e.g. BPH with severe urinary retention, GI obstruction, paralytic ileus, severe ulcerative colitis with toxic megacolon risk. Relative contraindications, seizure disorders, elderly, increased risk of confusion, delirium, heart failure, arrhythmias, myasthenia gravis, liver, kidney impairment, pregnancy or breastfeeding, use with caution. 8. Before taking this medicine, precautions. Tell your provider if you have glaucoma or increased eye pressure, have urinary retention or prostate enlargement, have GERD, can worsen symptoms, have tachyarrhythmias, have mental health disorders, especially history of delirium or psychosis, are pregnant or breastfeeding. Handling precaution. Wash hands thoroughly after applying patch. Avoid touching your eyes, can cause unequal pupil dilation, blurred vision. Driving alertness. May cause drowsiness, blurred vision, and dizziness. Avoid machinery, vehicles. Number 9. How to use Transderm Scop patch. 1. Apply 1 patch behind one ear to clean, dry, hairless skin. 2. Apply at least 4 hours before travel. Many clinicians prefer 12 hours before. 3. Press firmly for 30 seconds. 4. Do not cut the patch. 5. Wash hands after applying. 6. Patch lasts 72 hours. Replace if needed. 7. When done, remove and fold sticky sides together. Discard safely. 8. Wash area after removal. Drug can remain on skin. Number 10. Dosing information. Adults, 1 transdermal patch, 1.5 milligrams, every 72 hours as needed. For surgery, UMV, apply the evening before or at least 4 hours prior to anesthesia. Children, not routinely recommended, risk of severe anticholinergic effects. Number 11. Missed dose and overdose. Missed dose, apply as soon as you remember. If close to next schedule, skip. Do not apply extra patches. Overdose symptoms, anticholinergic toxicity, extreme dry mouth, dilated pupils, blurred vision, rapid heart rate, tachycardia, flushed hot skin, agitation, hallucinations, delirium, seizures rare, urinary retention, dangerously high body temperature. Seek emergency medical care immediately. Antidote for severe toxicity, physostigmine, hospital use only. Number 12. Stop or avoid taking. If you develop eye pain, halos, or blurred vision, possible angle closure glaucoma, you become confused, agitated, or hallucinate. You have difficulty urinating. You develop a severe skin reaction to the patch. You have a severe allergic reaction. Number 13. Side effects. Common, dry mouth, blurred vision, dilated pupils, especially if touching eyes after handling patch, drowsiness, dizziness, skin irritation at application site. Moderate, confusion, memory problems, constipation, difficulty urinating. Serious, seek immediate care. Severe eye pain or vision changes. Hallucinations or severe confusion. Fast, irregular heartbeat. Heat stroke due to decreased sweating. Allergic reaction, rash, swelling, breathing difficulty. Number 14. Vital information. Remove patch before MRI. Backing may contain metal and heat up. Avoid alcohol, increases drowsiness and dizziness. After removing the patch, effects may last up to 24 hours. Do not use in combination with other strong anticholinergics unless directed. Number 15. Drug interactions, other drugs that affect scopolamine. Increased anticholinergic effects. Antihistamines. Diphenhydramine, meclizine, hydroxyzine. Tricyclic antidepressants, amitriptyline. Antipsychotics, clozapine, chlorpromazine. Parkinson's meds, benztropine, trihexyphenidyl. Muscle relaxants, antispasmodics, dicyclamine, hyoscyamine. Increased sedation, alcohol, benzodiazepines, opioids, sleep aids, zolpidem, trazodone, barbiturates. May worsen glaucoma risk with corticosteroid eye drops, drugs causing pupil dilation. Thank you. Have a nice day. Thank you. Have a nice day.